Hello, I'm Dr. Diana Bitner from True Women's Health. I'm here tonight for our Let's Chat series about back to routines and how we get back to ourselves after the fall. A little bookkeeping first. Our next Let's Chat series is actually on October 14th called Surviving Cancer and Living Well. Again, it's on October 14th with special guest Tammy Myers. I can't wait until she shares her story with all of us. And it's really to think about how we can live with such a diagnosis as breast cancer at a young age and continue to live well. And Tammy is just a wonderful example of that. So back to tonight, I am pre-recording this because of a schedule conflict. And so if you have questions that come from tonight's episode, please feel free to email them to us on our website or a personal message on our Facebook page, and I promise that we'll get back to you. I'm so excited for tonight's topic. It's one of my favorite times of the year personally, so perhaps I'm talking from my own way of thinking about what happens after summertime in the fall to get back to our routines. But I think this is a really timely thing because as we all get back into our routines, we think again about ourselves, our family, our health, and how we can get back into our routine. So I always like to talk about why I care about a topic and then some details about the topic, about what it means to get back to our routine. And then we're going to discuss the experience at True Women's Health and how we can help you get back into that routine in a very special and novel way. And then to tell a story of a patient who experienced this with us. So this is what I want to share with you tonight. So why do I care about this topic so much? I care because I see women putting everyone else first and them suffering as a consequence. I see women suffering all this preventable illness, such as diabetes, obesity, heart disease, dementia, uterine cancer, osteoporosis, and risk for fracture. So I see women going along, taking care of everyone else, and they don't know that these conditions are developing under the surface. They might not feel so great every day, but they just kind of keep going and make it work. But unfortunately, these conditions are mostly silent until they're not. And I just recently have a patient who's starting to have some chest pain, some heart symptoms, getting her going with cardiology. But it can be really scary all of a sudden when, like, what? How did this happen? I was doing okay, I thought. So I don't want that to happen to women. And I know that it is possible for women to age as they want, but we've got to get in control of our health. It's all about taking control of our life map before it takes control of us. And we'll talk about that a little bit later in our segment. I care about women having the awareness and tools to do what they want, how they want to do it, and as long as they want to do it, whatever that is. Is it hiking and not being left behind by your kids? Is it kayaking? I have a patient, her goal is to be able to get in and out of her kayak again. Last time she got in her kayak, she got stuck. Wasn't a good look. So she wants to be able to get back in and out of her kayak and just kayak off into the sunset. And she feels limited right now by her weight and her energy level, and she doesn't want that anymore. Whatever it is that you want to do, look good in a bathing suit, feel like having sex again, not having big mood blow-ups, right before your period. Again, it's all about having what you want to have. And at True, that's what we love to do, again, is get you into what you want to do. Many women, including myself, we say in the summertime, the schedule gets a little bit more lax. We might entertain more, we stay up later. Maybe we still have to get up early for work, but we just get a little more lax. So maybe over the course of the summer, we get a little bit more fatigued. We might gain a couple extra pounds. We get a little lax with our eating habits. We drink a little more alcohol. But the problem is when we're younger, we can kind of maybe get away with that a little bit more. But as we get older, it's harder to get that weight back off. It's harder to make up for the damage to our liver, to our blood vessels from all that extra sugar and alcohol. It's harder to make up that sleep deprivation of a long summer with late night campfires or whatever it is. It takes us a lot longer to recover from that. So it's to be really aware of, we don't want to get too far behind in the summer when that happens, but then how can we quickly recover and get back into what we care about? I believe it starts with having a vision and having that clear goal for what it is that we want. Self-care is so crucial. And I want to start with the story of Mary, of course, not her real name. So Mary is a patient who came to us. She is a busy mom of 4 kids. And now that it's fall, she came to see us at True a couple weeks ago. And what happened is, of course, with COVID and summer, it was just a crazy time. She's got 4 kids. Her husband works a lot. She works part-time. And, what was happening, of course, in the summertime is, everyone had their social bubble, they had their friends, but they really were focused with staying home, not traveling. So it was just a really busy time. And she found herself really focusing on the family, keeping everybody happy, keeping everybody busy, making sure there was lots of good food around, and she just wanted to support her family. So she wasn't taking the time to prioritize her exercise. She used to love to get up early in the morning, but she was staying up so late with the kids and everyone around that she often wouldn't get to bed on time. So therefore, she wasn't feeling like working out early in the morning. Again, she was cooking for a lot of people, so she was eating a little bit more. And again, relaxing at the end of the day with an extra cocktail or, entertaining people. And again, everything just kind of got away. And now that it's fall, now she's all excited because, okay, I can get, back to the routine that she's got 1 kid in middle school, 2 kids in high school, and 1 child went off to college. So now it's like, okay, I'm back to my, part-time job, more regular hours. The kids have that hybrid school thing, but still a little bit more time to focus. And she was referred to us by a friend who said, you've just got to go see them at True because they can kind of help get everything back organized. When Mary first went to our website, she was a little thrown off by the way that we work, our business model. We don't participate with insurance in the regular way. And so at first she was kind of put off by that, like, well, why won't they just accept my insurance? And her friend said, you just have to go, just figure it out. And so she chose to sign up for our basic wellness model. And so she came in for her first appointment. And what I want to talk about now is, what is the experience like at True? What really happens, and why would it be worth it for you to think about your health in a different way and to think about trying this very specialized, personalized experience around your health? So, first of all, the complete, wellness program is where the visits are unlimited, and it's a complete wellness program that, again, the visits are unlimited and everything is included. We include visits with our nutrition coach as well as visits with our team. The other program is called the Basic Wellness Program, and that's a program where for people who prefer a fee for a visit schedule, so they can control the cost and have each visit where they pay a fee and they get a receipt. So it's just different depending on how much you might want to come in and what you want to get out of our program. So Mary signed up for our Basic Wellness Program to check us out first. And she went to the website and was really happy at how everything was explained. And again, she was able to sign up. Once people are signed up for our program, they'll get the connection to our app. And so at the app, what happens is that there are educational videos and content and health intake forms. The health intake forms can be a little long. They're divided into 6 segments. To be conscious of your time, we'll actually put on the top how long it will take. But women are saying the questions are really thought-provoking. They'd never really thought of their health in that way, and they see the difference right away by the questions that we ask. Also, there's a segment where it's really good to have your family history already in front of you. But for some people, they just stop the survey. They call their sisters and their mom or their grandma, whoever's around to talk about family history, get that information, and then get it all down in one place. And so again, it can be a little lengthy, but the questions are really thought-provoking and get people thinking about their health in a different way. The next part of the experience is where myself or Suzanne, our PA, will read everything before you even come in. So, the patients that I'll see tomorrow, I've already read their intake forms and I feel like I already know them. I'm getting to know them and their health history so that when they come into the clinic and they get that 1-hour appointment, then we can really be efficient and make sure we solve for everything even before they come. So we'll read all those questions, we'll get our note all ready, and we'll really have a sense before you come in. And, some patients have been concerned, like, tell me about the privacy on that app. Our app is HIPAA protected. It has many safety firewalls. And so that information is not just a regular phone app, it's a medical grade safety website. So again, we'll know so much about you before you even come into the clinic. And I would argue that you'll even know yourself better having to think about your health in this different way. So once you've watched the informational videos, once you've filled out your forms, then you'll come into the clinic. But before you come in, we want to make sure you get the necessary lab work already done. And so what happens is Amy, our nurse, will look over your chart, see what lab work you've had done. We're connected through Epic to many other healthcare systems. And so we'll be able to look in either Care Connect or in the Epic database and see if you've had any of this lab work. So we don't waste any of your money reordering tests that you just had done. But we order some blood work you might never have heard of before. One test called a CRP, which looks at your inflammation factor and gives us an idea of your risk for heart disease. We also look at your blood sugar over the last 3 months and really get a sense of where are you at in terms of your risk for prediabetes. And I truly am amazed at how many women we've diagnosed with prediabetes already in our first months of being open. So many women who have cravings for sugar that doesn't make sense, they're gaining weight that doesn't make sense, and actually they have a health condition that we can really address, and it answers why they're having these symptoms. So anyways, our nurse will call you, or Jill or Elizabeth will call you and say, this is blood work we'd like you to get. This is where the lab is that you can get it drawn. So when you walk in the door, we'll already have it loaded in front of us and we can use it to discuss. We prefer this over ordering the blood work after an appointment where you get a postcard in the mail that says, eat more fish. We really want to address and have a plan around your information at the time of your visit. So the next thing that happens is you come in for an appointment and it's an hour long. And the first thing that we'll ask you is, what do you want to solve before you leave today? What is hard for you? What is really the reason that you signed up for this? And what do you want to make sure we do to make sure this was worth your time, worth your money, and you'll feel really good about the fact that you joined True Women's Health? And so we want to address that right up front. Number two is we want to ask you, what do you want? What do you want out of your life? We only get this body one time. So what do you want to make sure that you age like? What do you want? And our whole program is around WAI, who am I? So we ask you all about your waypoints. And so waypoints is a process where we help discover your picture of self. Now that came from my brain in the sense that I think in pictures. So I think about how I want to be at a future event, and I can picture myself at that time. I can picture how I might feel, how I look, what I'm able to do. And as we go through the process of that first visit, we really focus at that first visit on A, B, and F. A is activity, B is obesity or your weight and your risk factors associated, and F is phase of ovarian function or all the hormone-related symptoms, be it you're on the birth control pill at your 25, be it you're 35 with PMS and menstrual migraines, be it you're 45 and starting perimenopause, or be it you're 75 and you're in late menopause and now you have vaginal dryness. So we want to look at these main 3 areas of activity, or rather areas of wellness. And again, it all goes back to just, discovering who are you and how do you want to be. So that's what we do. We love it when people come into the visit with a list, So sometimes, they'll almost be apologetic, like, oh my gosh, I've got a list. You probably hate lists. And I say, are you kidding me? I love lists because I'm a list girl. I love it that you have a list of what you're concerned about, and we can really make sure we check off, every box. When I have a patient who brings a list in at the end of the appointment, I say, okay, wait, let's look at that list again. Did we answer everything that's on that list? This is about you. And I can't tell you how much fun I have doing this. I tell my patients all the time, I can't believe I get paid to do this. I get to help you become who you want to be. I am so lucky that I get to be a part of your health journey. At True, our one thing we love to say is that you don't get lost in the system. At True, we'll know you so well that it really will feel very familiar, and we'll know you by name when you come in. and you don't get lost in the sense of we can really become partners in your healthcare. The next thing that we talk about are some of our tools. So one thing that we'll talk about in that first appointment, but is the seeds. So the seeds is something that we talk about, these 7 essential elements of daily success. Very soon we'll have a new ebook that will be available for download on our website. But the seeds are those 7 basic habits that really lay the foundation for healthy aging. So many women would say to me, I just want the magic pill. Well, there is no magic pill. It is lifestyle. The lifestyle factors that make a difference are again listed here in the seeds. And when a patient first comes in, she's probably already loaded her seeds into our app, but we'll ask again or then talk about barriers. So one of the seeds is drinking water. So many women will say, oh my gosh, I don't know how you do it. I'm busy, I forget, I don't get my water in. Excuse me, and in the middle of the afternoon, I would rather go for a coffee or I'd rather go for, some hot tea. I don't think about getting my water. So we talk about barriers, and then we talk about how important each one of those seeds are to healthy aging. So I look forward to downloading this ebook from our website and understanding what seeds are most important and to think about what you can do to get more of those seeds into your lifestyle. The next thing we talk about even at that first appointment is the MTS. So the MTS is the menopause transition scale. And I tell you what, even for women who aren't in perimenopause, some of these can still apply in terms of irregular periods, sex drive, energy, feeling rested. But they definitely especially apply to women in perimenopause and menopause. Now, this is a scale that I validated in a group of women who did not have a cancer diagnosis, also validated this in women with a cancer diagnosis, that this isn't just a random list of questions. This is a list of questions that apply to menopause, and they're consistent with other scales that are longer and more difficult, but it actually gives the same answers in the same summary, and it really does apply to this perimenopause or this menopause transition. So these are symptoms that we track every time that we come and see you. And actually, we recommend that you track these symptoms every week on your app to look at how the symptoms relate to your seeds. And then you can have the power to control whether or not those symptoms happen. Again, it is possible to feel good during the menopause transition and afterwards. It's all about having the knowledge to make that happen. And you might do okay even without, let's say, a hormone medication. You might do okay with just really doing your seeds and concentrating on a healthy lifestyle. So again, it's all about having this knowledge, and that's what we love to do at True. I love to think about the analogy of waypoints in terms of a financial plan. So when we think about waypoints, it's all about how do you want to be as you age? And all of our tools are representative of this concept. So when we talk about waypoints, basically back in 2009, I did a pilot study with 100 women, and I walked them through 5 visits over 6 months. That's essentially our complete wellness program. We do that deep dive into all of the areas of wellness that are described in waypoints. And one of the tools of our program is the book that describes the stories of the women who went through that pilot study. And the book is called I Want to Age Like That. And so it's the 3rd edition, and it matches the companion workbook. And the companion workbook is how does one actually do the process? And so if you live in California and you don't get to fly to Michigan to see us, we recommend you can even go to the website and read the description of the program and then get a sense of how to actually do the program. And this is such an important process. And one of the favorite things I like talking about is the LifeMap. So I mentioned in the beginning, do you want to be in control of your LifeMap, or do you want your LifeMap to be in control of you? And some women are still surprised, that we have enough basic medical knowledge about where you've been, what you've put into your health bank, like how much have you exercised? How strong have you allowed your bones to become by taking your vitamins and exercising? How have you treated your body to the date that we meet you? We put that together with your medical history, your surgical history, your family history, and we can actually predict with some accuracy how it will be that you age and what might be a real issue for you as you get older, including, heaven forbid, becoming frail or having a premature heart attack or having a stroke or having dementia. There are a lot of risk factors we can use to actually predict how you're going to be. And so I love it when we get to meet with women before too many of those factors are ingrained and it's too hard to turn back the clock. And so we use this tool that I developed called the LifeMap. I don't know how well you can see it, but this is in the workbook. And this is an example, for example, of Jane Doe. So Jane Doe, we looked at her picture of self. So Jane said, at 65, I want to be a 24. And what this is that if you think about each area of wellness is rated 3, 2, or 1. There are 9 areas of wellness. 3 times 9 is 27. So there's a total possible score of 27. Now, this isn't a competition. Jane never really wanted to run a triathlon. So her goal and her ability to be active was a 2. She wants to be very active, be able to walk between 5,000 and 10,000 steps a day. She doesn't want to be limited by too many barriers. She wants to have lots of good knowledge, but she really doesn't want to run a triathlon or go snow skiing. So she's really good being a 2. So she added up all her areas of wellness, and her picture of self is a 24. So when I first saw her at 50, at 50, she was a 21. So when we added up her place and process, all of her scores in the areas of wellness, she's only a 21. So basically what I said to her, what I would say to you if you were doing this is like, okay, cool. At 65 at retirement, you want to be up here. At 50, you're only here. Okay. So either we've got some work to do to up your game, or you can drop your goal. That's okay. We'll love you up. We'll support you in whatever you want. But if you want to be here, then we got to get busy. And so what we love to do at True is think about your barriers and think about what makes it hard for you to succeed, to get to your picture of self. And I've just experienced so many women who, once they really see it that plain and clear and really start to understand choices and consequences, they get busy. And we get so excited when people reach their goals and they reach their picture of self. It's just a really fun thing to see. And what is even better is that it helps women prevent illness that doesn't have to happen. It makes me crazy that in this country, we have the most expensive healthcare system of so many countries, but yet our population is not as healthy as it could be. It's not one of the healthiest populations in the world. And so 80% of our healthcare dollars in the United States are spent on preventable illness. I'm going to say that again. 80% of our healthcare dollars are spent on preventable illness. So we have to take charge of our health because no one is going to do it for us. We have to do this, but it takes knowledge to do that. One of my other favorite things that we'll walk women through is something called your life plan. So creating my life action plan. So the life action plan is how to take control of your health. And basically in each one of the areas of wellness, we look at your area of wellness, your picture of self, your place and process, where you are, what are the risks and the barriers, and then what is our recommendation? So how can we suggest that we help solve for that barrier? If you don't like to go running because your bladder leaks, let's get that addressed with some pelvic floor physical therapy, maybe some vaginal estrogen, and also maybe a visit to the urogynecologist because your 5 babies stretched everything out and it's time to get a little support in there. So whatever it takes, we want to address your barriers so they don't have to keep you from aging well. We know that women will put off a knee replacement, for example, at the same level of arthritis of a guy. The guy is going to say, fix my knee right now. And the woman's like, oh, I'll deal with it later. I don't want to deal with that. But then 25 pounds later, she can't even walk up the stairs. We really should have fixed that knee 5 years ago. So women cannot put off barriers that make it hard to be active, that make it hard to be participating with things in our life. Another tool we talk about is the sex deck. So a lot of women come in and say, my sexual health is really a problem. A woman said to me, this is a common thing, I don't care if I ever have sex again, but of course that's not okay with my partner. He still wants to be very sexually active. He still has a high sex drive and I really love him. So I'm going to try to make this work. But that can be really difficult because it's really hard to do something that one doesn't want to do, even if it's with a partner in a really good relationship. And so we talk about all the reasons for low sex drive. We know, for example, that women after 50, 2 of the most common reasons for low sex drive are poor self-image. Maybe she's gained weight. Maybe she's really tired from taking care of everyone else. Maybe she's just, overrun with work and kids and her parents, that the last thing she wants to do at 9 o'clock at night is have intercourse. And so We talk about workarounds or barriers to get around with that and how to have a conversation about that without hurt feelings. Another reason is lack of emotional connectedness. And what happens is that couples just get busy. And so they haven't done anything fun together. They haven't talked. Maybe there's been some conflict that's kind of gotten in the way. And so, in order to want to have sex and get naked, it's really important to still like your partner and feel friendly with them. So the sex deck is a game, it's a game. I hate to minimize it with a game, but it's a game of cards. And each card has a reason for low sex drive and then why that would have happened and what to do about it. So I wish every healthcare professional had this in their pocket because it would help them initiate that conversation with you because it wouldn't be so intimidating. So many docs and nurse practitioners and PAs really don't want to bring up the conversation about sex because they really don't know what to say once you tell them you have no sex drive. It's such a complicated conversation, or it can feel that way if you don't know how to talk about it. So I wish every healthcare professional had this in their pocket, and I wish every person had the sex deck because then they could use this to not only think to themselves why sex might be an issue or why they have low drive, to know that there are real treatments for low sex drive, including that hypoactive sexual desire disorder, meaning that switch flipped and you just don't even want to think about sex. There are actually medications that can help with that. I want this to be in every partner's hand to take home to their partner and say, look, it's not your fault. It's not my fault. There are real reasons for low sexual desire. So anyways, the sex deck is something that I came up with, and it's available on our website for you to check out. And another thing is our symptom circle. So you can go to our website and you can definitely check out the symptom circle under resources, and you can look at tools to check your symptoms. The symptom circle actually circles on the website. Thank you, Joe at Leverage. It's amazing how this flips around, and all the symptoms are around the outside, and what you can do to make them better or worse is on the inside. So it's a good way to put the knowledge in your hands to do. So again, back to the experience at True. Once we've gone through your life map and your life action plan, what happens is we have, again, this app, and that's how you stay connected to our team. Through the True app, you can track your seeds and your MTS daily if you want, but we recommend at least weekly. Let's say on Sunday night, you put in your seeds, you put in your MTS, and you can really see how you did in the last week. I ate more sugar, I had more hot flashes. I didn't exercise, I was more tired. I didn't drink my water, I had hot flashes and I was tired. So it's a really important way to look at how it worked last week. And so then I can go forward. I kind of think about it, again, back to the financial plan, like a budget. If you look at your budget at the end of the week and say, wow, I spent way too much money on coffee or stupid t-shirts that I didn't need or whatever. Wow, next week I'm going to really do better and I'm going to watch my spending. I think about that same way with our lifestyle habits. Every Sunday night I look at my exercise, for example, and say, okay, my goal was to do arms for 3 days, legs for 3 days, ride my bike, do my yoga. Wow, I didn't quite get in enough. So I've got to do better next week. And so I make my exercise schedule for the next week and I make my plan. It's just really straightforward. But once we have that plan, we're ready to go. So again, the True app is a way for you to track your symptoms and your habits, but it's also a way to stay connected to us. When you have tests done after you leave the office, we communicate with you in the app and we say, hey, your test came back. This is the result. This is what you can do about it. And if you have any questions, let's schedule a time to chat. But the text is so great because, again, none of us have time to be on hold. I was scheduling an appointment today. I was on hold for 10 minutes, and I don't have time for that. You don't have time for that. So it's a way that we can quickly text back and forth, that we can just, get our question answered and be done and get on with your busy life. If you have ongoing symptoms, you can text us. We can even answer in the app. And then one of our team members can talk to you, or you can come back into the office for a visit, such as for a vaginal infection or a bladder infection or whatever it is. We can schedule that even on the app. We want it to be easy for you. We also love it when people send us notes about their successes. So last week we had a patient who texted us that she had lost a whole pant size. And so right away we got so excited. There's me and Suzanne, our PA, and Amy and Jill, we right away gave a thumbs up. We sent a picture of us to her in the app. And we just were so excited. Amy all of a sudden said, "Everyone, come here, look at this result." She dropped a pant size, and we're so excited. And this is a woman who has prediabetes, she's in menopause, and she's actually getting some really good success with seeds and MTS. And so again, we're so happy and proud that we get to be a part of people's lives, and we have this app that we can stay in touch. We have patients that are traveling, and again, it's a way for them to stay in touch very easily. We have a patient who's sending us pictures of her plates so we can see what she's eating. She took a picture of her refrigerator so you can show us her food. We had people who go to the grocery store after an appointment with Chef Anna, and they take a picture of what's in their cart and they send it to us and they send it to Anna. And it's a really good way to stay in touch and kind of get things going as we're learning so much about our health. And so again, our website is another resource that you can use to see what's going on, to see maybe where we're out in the world talking, or we have lectures or group visits. As COVID hopefully is hopefully we're allowed to do more things soon, and hopefully it allows us to free up a little bit for more group classes, in our space, of course, in small numbers with masks and social distancing. But we really look forward to having more events, and we'll definitely advertise that on the app. And as I'm out there talking and we have guest lecturers come in, we'll be posting all of that on the website. So we really want you to use our resources tab. We also have a community circle tab where other members of the community that are participating in women's wellness and well-being will definitely want to promote what they're doing to show people what's available in our community and outside, just to know that there are a lot of resources. So again, I want to get back a little bit to Mary, just to give a sense of, what happened with Mary. So as Mary came in for her visits, she came and saw us for several visits to really get her health organized. She really was excited that we were really taking a deep dive, and she felt right away that we were taking her seriously, listening to her concerns and what she wanted, and we were able to give her a real plan. She ended up meeting with Chef Anna to really look at menu planning. Anna gave her a shopping list. She was able to really start thinking better about complex carbs. She was able to get off the sugar. She pulled back on the alcohol, and that was a big part of her starting to feel better. So, we really made a sense of all of her background, her medical history, her social history, her habits, her family history. It wasn't just taking her little snippets of information. We put the whole big picture together, and she could really feel that difference. She had a lot going on with family stress. We all do with COVID and how that's changed our life. And again, she was able to get a plan and put everything together. She really wanted to be not tired. She wanted to reconnect with her husband. She wanted to want to have sex again. She wanted to not have these big mood blow-ups right before a period. And she was able to understand why those things were happening, and then had a plan and treatment options to feel better in this phase of her life. So again, she felt like everything was put together. And she actually then upgraded to our complete wellness program. And for $200 a month, she was able to have unlimited visits that were all included in this plan. And again, to meet with Chef Anna. Very soon, we're hiring a psychologist who's going to start in our office, and she would also be available for Mary to see if she ever needed to see someone and have some structured talking and some new coping mechanisms around the stresses and the challenges of not only PMS with her periods, but also with her kids, with her husband, with her ongoing life. She also came to see Suzanne, who specializes in cancer risk assessment, and really did a deep dive. Mary had several relatives with cancer and actually decided to do genetic testing to make sure that she didn't have any issues, and those results are still out there. But it's all about making sure that we can surround. Suzanne also has done primary care for many years and specializes, in how can we be a little bit more aggressive about helping Mary get her cholesterol down. So again, because she was in our complete wellness program, we did a deep dive into her wellness in all 9 areas. And again, she was really happy to have this plan. So in terms of, again, how we do our work, yes, membership is required because that's what it takes to do a deep dive into your health. Do I think insurance should pay for wellness visits in this way? Yes, I do. Do I think employers should pay for wellness visits of this caliber? Yes, I do. If employers want a healthy workforce, they have to invest in the care and the health of their workers. And so, for women to feel their best, we've got to treat the symptoms that happen with aging. And so, again, yes, this is a new way of thinking about healthcare. But so far, the patients who have joined us are just so happy and now wouldn't want it any other way. And so I'm so excited. If you've had a crazy summer like Mary, like me, it's time to get your health organized again. And I just so hope that you go to our website and check out what we do and to see how this might fit into your life. And there's different programs that might fit your plan. We also have the Empower program that is for women 25 and under who want that one visit and maybe a follow up as they need it, but to be their person, to be that first visit to really comprehensively talk about women's health and wellness and family planning and sex and all those things that they might not ever have. I had a patient recently who was 18. She came in for her first visit, and by the end of the hour, she said, "Oh my gosh, this went by so fast, and this was so fun." And she told her friends at high school, and actually, they've all now signed up. So that Empower visit is a really great time to connect with women before they even start their healthcare journey and to really help them make good choices very early in life. We also have the Silver Wellness Program, which is for women who are 65 and over who want that one time visit to really get everything organized. And then, if they need, certainly a follow up visit, but to really get that visit to pull everything together. And maybe they don't feel that they might need the wellness program, although I'll tell you, many transition quickly to the wellness program from the Silver Wellness. So, again, we're so excited to provide this service and we just want to spread the word. So please share, please like this page and share it with your friends and family that you care about. And we're happy to serve you. So take care, be true to you.